that's also something very interesting about nails is that sometimes you're seeing the beginning of something and the patient doesn't even really have the classic symptoms. And the classic association is with chronic renal failure and congestive heart failure, diabetes, or an infection of the liver, such as cirrhosis. Those distinctions are very, you wouldn't look at a nail and say, this is 2/3, it must be this. If I see a white situation in someone's nails, I'm getting general labs, I'm taking a thorough history, and I'm trying to uncover if something has been missed or something is brewing.
Welcome to Salad with a Side of Fries. I'm your host, Jenn Trepeck, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. Hey friend, welcome back to Salad with a Side of Fries. I'm Jenn Trepeck, your host and health coach, here with you every week for wellness without the weirdness. And you know those idioms that we hear like the eyes are the window to the soul, or the way to someone's heart is through their stomach, right? Well, this week's guest has a new one for us. She says nails are the crystal ball of internal health. And based on that, we have so much to talk about. So let me introduce you to her. She is the only board-certified dermatologist in the U.S. who devotes her entire practice to the diagnosis, treatment, and surgery of the nail. As one of the most trusted and respected nail specialists in the country, patients all over the world, from celebrities to luminaries, come to her bustling Fifth Avenue, New York City, and Hamptons practices. After observing what her patients were using on their nails, she determined that nail care products on the market were formulated with harsh chemicals and not backed by science. She knew there needed to be a change and that she was the person to do it. Drawing from almost 2 decades of nail expertise and her vast knowledge of product chemistry, she founded her eponymous nail care brand with the mission to revolutionize the at-home nail treatment industry and change the way we care for our nails. She is the nail expert choice for the media. Vogue magazine called her the go-to dermatologist for nail disorders and cosmetic conditions relating to nail disease. She is also a contributing editor for Nails magazine, where she writes a column entitled A Day in the Life of a Nail Doctor. In addition to her impressive career, which includes a position as assistant clinical professor of dermatology at Mount Sinai School of Medicine in New York City, she is also a busy mom of 3 boys and a rescue basset hound named Bo. Please give a warm salad with a side of fries welcome to Dr. Dana Stern.
Thank you so much. Wow, you really did your research. You even included Bo. So thank you.
Listen, I do what I can.
My most spoiled child.
Like for so many, I think. Yeah. Well, welcome officially to the Salad with a Side of Fries community. And when we were first connected, I thought it was like amazing to me that we hadn't yet talked about this topic of nail health and our nails. But then after our last conversation and everybody heard in your bio, the reason is because there just aren't more people like you out there. So I'm really thrilled that you're here.
Thank you so much. That's very kind of you to say.
Absolutely. And so we have one more piece of housekeeping, and then we'll dig right into all the research and everything you can share with us. So for that last piece of housekeeping, we have to tell our members what they're getting this week. So members, your recipe this week is for 20-minute shredded chicken verde. So if you don't like verde salsa, you could swap it out. It's beyond easy to make. It's light and bright for the season. Plus, there's so much you can do with it. I love this one. I think you're going to love it too. And Dr. Dana is giving our members a discount on her Dr. Dana nail care line. So all of those details will be in your email. I think it's 20% off their first order, right?
Yes, that's right.
Awesome.
Great.
Yes. So friends, if you want this recipe, you're 20% off from Dr. Dana. Be sure you're a member. Go to glow.fm/salad with a side of fries. For just $10 a month, you get weekly recipes, a monthly article or tool, extra discounts from me and our partners, plus access to live Q&A sessions. It's a total deal. I say it all the time. It's a steal when you take advantage of the full offerings because you save far more than that $10 cost. It's a no-brainer way to show yourself that your health is a priority. Plus, being a member supports this podcast and this community so we can bring you new episodes and experts every week. So remember, you're going to glow.fm/salad with a side of fries, or just click the link in the episode notes because that's a lot easier. Once you're there, you click support now, enter your email and payment info, click subscribe, and you're all set. You'll get this week's recipe for the 20-minute shredded chicken verde and 20% off from Dr. Dana. Okay, Dana, we heard your credentials and introducing you, and so I just want to jump right into it. You say nails are the crystal ball to internal health. So tell us more why you say that, and what do you see when you're looking at someone's nails?
Sure. So nails can tell us so much about what's going on internally. And there are, rare things that people like I see, such as indicators of iron deficiency anemia, for example. The nail can actually start to grow in a very abnormal fashion. It actually looks like a spoon, and it's called koilonychia. So if you could imagine, the nail would be able to balance a little drop of water on top of it. So there are some kind of esoteric nail findings that if an astute physician or provider knows the associations, we can really uncover these internal issues. Other signs are, sometimes the nail can turn white, and that's the broad term for that is leukonychia, but there are different patterns which can indicate things like diabetes or congestive heart failure, even arthritis. The other thing that nails tell us is a lot about a patient's kind of psyche. And that is because there are just so many habit-related nail issues, things like nail biting, onychophagia, picking, onychotillomania. And, these entities are associated with the obvious, things like anxiety, but sometimes even just people who need to be in a constant state of motion tend to be people who, once they stop, they kind of start picking or biting. So it's not necessarily anxiety related, but certainly if I were examining someone, I always joke, my patients, when they come to see me, fill out this extensive nail focus questionnaire, and it asks them about habits, even without looking at the questionnaire. I can look at someone's nails and know what's going on. And so that really does tell me a tremendous amount about someone's health, both internal and, potentially psychologically.
Yeah, so let's go through a couple other ones like Lindsay's nails and Terry's nails.
Right. So Lindsay's nails are called half and half nails, and that's when the proximal half of the nail, so the half that's closest to the cuticle, tends to turn white, and the distal half remains kind of pink. And the classic association is with chronic renal failure. And interestingly, Terry's, which is when the white is 2/3 and the pink is 1/3, tends to be associated with congestive heart failure, diabetes, or an infection of the liver, such as cirrhosis. Those distinctions are very, you wouldn't look at a nail and say, this is 2/3, it must be this. If I see a white situation in someone's nails, I'm getting general labs, I'm taking a thorough history, and I'm trying to uncover if something has been missed or something is brewing. That's also something very interesting about nails, is that sometimes you're seeing the beginning of something and the patient doesn't even really have the classic symptoms. And that's potentially very helpful in kind of nailing the diagnosis.
Yeah.
Yeah.
Yeah, it's interesting because I think sometimes, we actually see this a lot with oral health too, that you're seeing things before it manifests in the symptoms that everybody seems to be looking for. I think it's probably worth mentioning like brown or black band, right, is typically...
Oh, for sure. Yeah. So pigment in the nail usually presents as a brown to black kind of streak in the nail. And that's due to the fact that the nail, just like our skin and our hair, actually has cells which are called melanocytes. and they are capable of producing pigment. They're typically in our nails, they're typically dormant or sleeping, so to speak. So our nails tend to be clear. But if they get stimulated, and the stimulus is usually some kind of trauma, they simply start to wake up and start producing pigment. And that process is very common in people with darker skin types because they simply have more melanocytes statistically in their nail units. And that's called benign melanocytic activation. So these pigmented bands in the nail are most commonly benign. However, just like we can get a mole on our skin, believe it or not, we can actually get a mole on our nail matrix, which is the growth plate. And the tricky part here is that a mole in the nail also looks like a brown pigmented streak. So the take home here is that if you have really a single pigmented band, meaning that one of your nails has this brown streak, that's something you want to see a board certified dermatologist for, to really examine, look at the pigment pattern and decide, do you need a biopsy? And I do want to say May is Melanoma Awareness Month. And just a reminder to schedule your annual skin check. You should always go to your skin check without polish on, because here we are talking about nails and how much they can tell your physician about the state of your health. You want them to be able to do a proper exam.
Yeah, I love that. I'm going to come back to the polish question in a second, because you also had a breakthrough study on brittle nails.
Yes.
So will you tell us about it?
Sure. So, wow, that was a long time ago. You really dug deep, but it was a breakthrough study. It was published in our premier dermatology journal, the Journal of the American Academy of Dermatology. And basically, there was this, erroneous kind of fact that had been floating around, and it was even in the literature, that said that brittle nails had a specific percentage of water compared to normal nails. And it was so specific, yet there was like no studies anywhere to back this up. And I kind of went through and I would find these references and then they would lead to nowhere. And so I decided, I want to test this out. Is this really true? This doesn't make sense to me. So we did a real experiment. And what we discovered was that, in fact, brittle nails do not have less water than normal nails. It's not about the water at all. And in fact, a single nail can even vary within a nail. The water percentage can vary within a single nail, and from a left pinky to a right pinky. And so the water content is constantly in flux. In fact, a nail is 1,000 times more absorptive of water than the skin, which is why when, kids, it's always advised to cut your child's nails after a bath, because they're going to be so soft. They're like little sponges, and they're going to be a lot easier to cut. So it was kind of crazy. My chairman at Mount Sinai, where I was a resident, used to advise people to wet their nails and then occlude them. And so, all of these recommendations kind of have been tossed out because of this study. And, we're always trying to offer real science, with our recommendations. And that set me on a path, because I got really excited about the fact that there was so much to discover within the nail universe. And then, when I started practicing, I was absolutely floored by the products that my patients were bringing in that had not only no scientific validity, but a lot of them were toxic, had, ingredients that were very controversial and were clearly doing more harm than good. And it just was so ironic to me, because dermatology has had like this real kind of revolution, I would say, in that we've really made so much progress and innovation. We're not just recommending any old moisturizer. We actually understand why moisturizers work and what the lipid barrier is all about now. And it just seemed to me like nail care had been left in like the 1950s. And so I kind of dove right in, and that's what led to my kind of product journey, so to speak.
Yeah. Yeah, I love it. And so speaking of, kind of seeing our nails with, taking the polish off when we go to the doctor and all those things, what do you want everyone to know about, like right now, between the different kinds of polishes that people wear and, UV light and, because some of these products are so toxic, and like, what does everybody need to know?
Sure. It's pretty simple. I'll start by saying that all polish, be it basic polish, be it, gel, classic soak-off gels, dips, acrylics, all polish is made from chemicals, okay? There's really no such thing as, vegan, or these are all marketing terms. And polish has been around for a very long time. And in general, most basic polishes are safe. I'm specifically referring to the kind of polish that you put on that chips 3 days later,
Right.
The enhancements, the gels, the acrylics, the dips, those are where you're going to start getting into more trouble. And the consequences, the negative consequences of those products relate to potentially damage to the nail and surrounding skin. And then, of course, broader potential damage when we talk about the UV controversy, I'll call it, and potential allergies, which are real. And so in general, I tell my patients, if you're tolerating, doing a gel every 2 to 3 weeks, good for you. Like, you must have superhuman nails because, soak off gels, there's one of my colleagues, Tanella Tosti, did this early study when they first kind of became popular, where she used ultrasound technology and simply proved that when you remove a soak off gel, guess what? It creates a thinner nail plate. So it definitively weakens and thins the nails, making them more prone to brittleness and breakage. And she proved that. The UV controversy, I have a lot of colleagues who have spent a lot of time looking into this. My messaging for that is use a broad spectrum sunscreen or a fingerless glove when you're getting those UV gels, because there is definitely a potential for, without a doubt, photo aging. Nobody wants brown spots, wrinkles, loss of elasticity and collagen, right? Because that's an aging hand. And that's going to happen if you are getting regular UV exposure on your hands. There is no debate. The question is there a statistically significant risk of skin cancer? So squamous cell, basal cell, and potentially melanoma. And that we do require more studies, but there have been reports of people who have had, frequent gel UV exposure and have reported hand non-melanoma skin cancers. And so, at this point in time, the take-home message, the advice is use protection, because we know that UV radiation definitively is associated with skin cancer, UVA specifically in the case of the nail lights that they use.
Awesome. I think it's super helpful for everybody to just hear it from you, and in a way where I like, what you were saying about, if you're going to do it, wear the gloves, right? You get to decide for you, and here's how to make a more informed choice.
Definitely. And there are some other interesting kind of things to be aware of when we talk about the soak-off gels. I just want to throw this in because they're so common. If you are on certain medications, namely tetracyclines, that combined with UV light can cause the nail to lift or separate off the nail bed. That's called onycholysis. And that's actually called a photooncolytic reaction, where literally your nail is lifting off the bed. So if you're taking, doxycycline for acne, these are common medications, or maybe you have Lyme's disease and you get a gel manicure, that can be an issue. And so there's like these kind of esoteric potential adverse events that can happen as well that I want people to be aware of. But in general, I say the gels are for, occasions, the wedding, the out of town trip. It's uncommon that you can tolerate that level of trauma, because the trauma really relates to the removal process typically. And there's tremendous variability with how these products are removed. So, if you're using an electric file, if you're scraping vigorously with a metal implement. So most people won't tolerate that every 2 weeks.
Yeah. Is there a piece of, I feel like I've heard, let the nail breathe. Like, is there a piece of, not wearing polish for a period of time that helps nail health and nail quality?
So it's funny, I get asked about nails breathing a lot. And I just want to clarify, nails do not actually breathe.
They don't have lungs, right?
Yeah, they don't have lungs. It's a saying, but they do, importantly, derive their nutrients and oxygen from the bloodstream. So a healthy nail requires good peripheral perfusion or good blood flow circulation. And so what does that mean? Well, as we age, we tend to have poor peripheral circulation. And that's why we often start to see these issues with nails, such as classically brittle nails, ridging, peeling as we age, because of that compromise in peripheral perfusion. But that's another reason why it's so important to engage in cardiovascular activity. And if you're not able to do so, another way to achieve good blood flow would be hand massage. And it's funny, I had a patient just last week who came in with this big bag of product. She had tried everything for her brittle nails. And she told me that there was a period of time when she was using this cuticle product, and she was using it like 10 times a day and massaging it in. And it was the only time her nails looked decent. And I said, guess what you were doing? You were actually improving your blood flow to your nails. It had nothing. I said, I'm sorry to tell you this, but I don't think that had anything to do with that product per se. But it was interesting to hear that anecdote. So cardio.
Yeah, so interesting. And it's
all for your heart and nails.
Yes. And it's all coming to where I want to go next, but I'd be remiss if I didn't ask this question. What do our cuticles tell us about the quality of our nails? Or is there a connection there?
Yes. The cuticle is I preach about the cuticle on a daily basis because I love the cuticle. The cuticle is really this incredible physiological structure. It is like this sticky membrane. And I tell my patients that it's analogous to the grout between your tiles in your shower. If you didn't have that grout there and the water was hitting those tiles, what would happen? You would start to get mold and all sorts of organisms in those crevices. Guess what? That's what happens with the nail. If you remove your cuticle, the cuticle is the nail's natural protective seal. It's what prevents water, moisture, and then organisms from entering into your nail unit. And very importantly, right beneath the cuticle, if you look at your thumbnails, you can typically see a half moon. That is actually called your nail matrix. That is the growth center of the nail. That little delicate oval tissue is what produces your nail. And so if the cuticle is compromised and water and moisture and yeast get into the nail unit, and then you suddenly have this wet, swollen body environment where your new baby nail is trying to grow, your new baby nail is never going to grow in normally. So it's going to come in with patches and surface irregularity and bumps and possibly separation. And so this is something I commonly see in my office is, I'll see somebody with 4 disrupted cuticles, and all 4 of those nails are completely abnormal. And then I point out where they have an intact cuticle, they have a perfectly healthy, normal nail. So I'm not a fan of cuticle removal, in case you didn't pick up on that. Um, and so we should keep our cuticles hydrated because they are these delicate membranes that can become extremely dehydrated and then they lift and separate. You can get hangnails, which can lead to infections, lots of different types of infections too that we can get into as well. And I do want to also mention that at the salons, when you tell them not to cut your cuticle, which you should always do, just please push it back. They now often use a liquid cuticle remover. And I just want you to be aware of that because that's the same exact thing as snipping the cuticle off. And what that does is it actually destroys the cuticle. And sometimes you think they're just putting some cuticle oil on you and you have no idea. Maybe you're like looking at your phone or reading a magazine or zoning out. So when you tell the nail technician not to remove your cuticle, also be sure to tell them not to use a liquid cuticle remover.
These are such key insights. And this speaks to even going back to what we were saying before about the quality of products. And I also want to ask you about, nutrients and supplements like biotin and omega-3s and all that kind of stuff. Let's do that after we highlight our partner for this episode. Big thanks to Layered Jewelry for supporting Salad with a Side of Fries. The modern woman is multifaceted, taking on many important roles in the various aspects of her life. Inspired by her own multi-layered life as a busy mom, trendsetter, entrepreneur, and influencer, Amber Ridinger McLaughlin set out to create a line of luxury jewelry that lets women create their unique style and celebrate their own beautiful layers. Layered is luxurious and affordable, the perfect combination for the modern woman. Layered allows you to mix, match, stack, and layer pieces that make you feel empowered and beautiful. Each piece is handcrafted to be unique and exquisite just for you. So this is actually the perfect partner for today. You're going to level up your game on your nails and then let Layered Jewelry draw even more attention to your hands. So maybe it's the Justine paperclip bracelet for just $66.50 or the Candace tennis bracelet for $149.95. My personal favorites are the rings. Actually, they have stacking and statement rings starting at just $46.95. All of these prices are before your 10% off and free shipping for being a Salad with a Side of Fries listener. So simply text the word LAYERED, LAYERED, to 844-947-4846. You'll receive the link and coupon code right to your phone. Again, simply text the word LAYERED, LAYERED, to 844-947-4846 to get this handcrafted, luxurious yet affordable jewelry at 10% off and free shipping. This is a toll-free number. Standard text and data rates may apply. Okay, it's funny, like as I'm thinking about this whole nutrient thing, and then the idea of nails being the crystal ball to internal health. Is it a chicken and an egg thing of like the stuff we do topically can deteriorate or improve the nails, but the only way to improve the nail is through the internal health, right? Like how do the two pieces between topical and internal work together?
Right. And I think I didn't fully answer your other question about, taking a break and letting your nails breathe. What I always like to remind people is it's not just about taking a break. It's also about treating your nails during that break with the right products and tools. And it's the same idea. The funny thing is most of the products that I have developed have come from my background as a board certified dermatologist. And so it's the same idea as taking care of your skin. Your makeup is obviously going to look a lot better if the underlying canvas is smooth and, plump and radiant. And so the same is true for the nail. And so it's not enough just to say, okay, my nails are trashed from these gels. I'm going to take a break for a week. You need to rehabilitate your nails. And that's where the right ingredients come in and the right tools. And that's the key to maintaining a healthy, beautiful nail. is those in between maintenance habits and the products you're using.
Yeah. So, what are some of the ingredients that we want to avoid?
So, in general, polish removers are all, and I wear polish. I love, fun colors and changing up my look, but polish removers are all formulated with some kind of solvent. And solvents vary tremendously in how much they actually are going to dehydrate the nail and damage the nail. And the classic, strongest solvent is acetone. And that's why we use that to remove, these very adhesive, strong soak off gels. You want to avoid acetone as much as you can. So look for a non-acetone polish remover, preferably one that is loaded and fortified with lots of essential oils, because some of them can be actually quite hydrating if they're formulated in that way. One of the biggest ingredients that I preach about avoiding is formaldehyde. And it has largely been eliminated from a lot of products, but I still see a lot of patients coming into my office who bought things online from other, when you buy things online, they're not necessarily coming from the USA. Every country has different standards, even states. And so formaldehyde will initially cause the nail to harden. And so people think it's like this miracle product because it stiffens the nail. But over time, it will actually cause paradoxical brittleness. And it has a whole host of other issues, namely potentially a carcinogen. It can cause allergy. It can cause the nail to separate and lift. And so big time avoid formaldehyde. And when patients bring in their products, we often have trouble even finding the ingredients list. So definitely make sure if you bought like this miraculous new nail hardener that you look to see if it has formaldehyde.
I know, quick question on that. So in the food world, right, when we have an ingredient that becomes persona non grata, right? The manufacturers start to call it different things, but it's still the thing. Is formaldehyde now going by other names on labels?
Not to my knowledge.
Okay.
Yeah, not to my knowledge. And
okay. No, that's
US,
fair.
The US does allow a certain percentage of formaldehyde in products, but in general, I say don't use any formaldehyde.
Okay, great. And then thinking about improving the nail quality, what are some of the ingredients that we want to look for, right? If we're avoiding formaldehyde and some of the others. Yeah.
For sure. So there's been some real scientific research showing that the alpha hydroxy acids, namely glycolic acid, can help to rejuvenate a damaged, dry, brittle nail. And so this was like kind of breakthrough for me when I first started reading these studies that were initially coming out of India. It makes a lot of sense. If you were to look at the nail under a microscope, it's essentially like layers of dead cells. And just like you picture dry skin, if you have flaky dry skin on your leg, you're not going to just slather a whole heap of moisturizer on, right? Intuitively, you're going to exfoliate and then hydrate. And we do that on our face routinely, right? We exfoliate. Maybe we're using a chemical exfoliant such as glycolic acid or a physical exfoliant. Either way, we're removing those layers of dead cells so that we can effectively hydrate and potentially treat. And so glycolic acid is a very effective ingredient for brittle, dry, peeling, dehydrated, gel damaged nails, because what it's doing is it's removing those dead layers so that you can then effectively strengthen and hydrate. And so it's, again, going back to dermatology, it's the exact same thing we're doing on our skin. Other ingredients to look for are, there is a strengthening ingredient, which is in a number of products now, called Pistacia lenticus. It's actually derived from, otherwise known as mastic oil. It's from a evergreen tree. It's actually like a sap. And there's some studies showing that it can strengthen, it's a natural nail strengthener, plant derived, very interesting ingredient. So those are some call outs that I personally.
Excellent. And you mentioned essential oils. Are there specific ones like a tea tree oil versus, others?
So there's some data showing that products that are rich in phospholipids help nail flexibility. So that includes things like sunflower oil. So I would definitely, sometimes I just tell people, get some sunflower oil. It's cheap, and massage it in. It's a really effective cuticle and nail moisturizer.
Awesome. And then there are so many products out there too. Like I'm thinking of biotin, omega-3s, like supplement wise. I know biotin may not be worth the hype, but so curious to hear, like, what does the research show? What are some recommendations there?
Yeah. So biotin is interesting because when I was a resident, and unfortunately, I wish I could say it was like 2 years ago, but no, it was like, I mean, we're almost at like 20 years ago. That was the go-to. That was what we were told was the recommendation for brittle nails. And there were a few studies in the literature. Biotin is water soluble, so you don't really, it was kind of thought of as a very benign recommendation because unlike certain vitamins, A, D, E, and K, for example, that accumulate in fat, important for your listeners to know that just because something is a supplement or a vitamin doesn't mean that it can't be harmful, right? If taken at the wrong dose. And biotin was thought to be kind of harmless because it doesn't accumulate in your body. Whatever it ends up being excreted out in the urine. And there was some data to show that it likely helped nails. But then when was this? It was probably about 2000. Gosh, I'm like time warped from COVID. It was definitely before COVID. The FDA issued a warning that they were starting to see these, what they call biointerference, where people who were supplementing with certain levels of biotin and then were going to have blood work done, their blood work results were all skewed and all over the map. And
I've seen this with clients in their thyroid blood work.
Yes, exactly. Exactly. It was very common with thyroid specifically, but there was actually a case of somebody who was having myocardial infarction, a heart attack, and they got cardiac enzymes and the results didn't make sense. And so, really scary. And they determined that in levels as low as 10 milligrams of biotin, which is not a very, very, it's very easy to consume 10 milligrams of biotin. You could go into any drugstore, health store, and buy a supplement that's either going to be typically 2.5, 5, or 10 milligrams. And if you're taking multiple supplements and each one has a little bit of biotin, before you know it, you're taking 10 milligrams. And so when the FDA came out with this warning, I went back and I reviewed all of the studies on biotin because anecdotally, I had never been completely blown away by just seeing the patients in my practice who were taking it religiously. I have like this very unique practice where I get to kind of see the real world and how people are responding to things. And so I never really was like so blown away by biotin. And the studies were really lacking in vigor. They weren't like these large, robust studies. And so I stopped recommending it. So unfortunately, I will say there is to date no miracle supplement for nails from a real science perspective. You know, what I mean by that is there's no robust studies showing that X supplement is truly, statistically significantly effective for brittle nails. Nails are composed of protein. Keratin is a protein derived substance, and just like our hair. And so I have started telling my patients that, and you probably talk about this a lot, protein intake. I think a lot of people are not consuming enough protein. I mean, I'd be interested to hear what you have to say about this. I live in a house with 3 teenage boys who play football, and they're all, they lift, they want to bulk up, they're obsessed with their protein intake. They are counting the grams every day. And I do think there's something to be said for, as we get older, perhaps we're not consuming enough protein, the classic older person's like tea and toast diet. They always spoke about that in medical school. I don't know if that's like a well-known thing, but apparently older people do not eat a lot of protein. They drink a lot of tea and eat a lot of toast. But healthy nails need protein, and there's no debating that. So I do say to my patients, if you're not able to consume a lot of protein, consider a protein supplement. But I'd love to hear what your thoughts are on protein.
Yeah, for sure. So everybody, generally a proper serving size of protein at a meal is 4 to 6 ounces for a woman, 6 to 8 for a man. So we're talking your whole hand, not the palm like we were taught, years ago. And then a snack is the palm or a little less. That's 2 to 3 ounces. And so if we're eating that amount and we're eating throughout the day, we will get enough protein. But I do think the quality of our protein has become a challenge. And as we age, we aren't physically as good at assimilating those proteins, right? Breaking it down and using all of those amino acids. And so I agree with you. I think at some point, a greater commitment to supplementation, a greater commitment to the quality protein choices is really helpful and important. So awesome. I love that. But final thought, anything we missed, something, if we didn't talk about it?
I mean, I would love to recommend some specific products.
Go for it. Go for it. Tell us.
Well, so one thing we haven't really talked about is it's not just the products, it's also the tools we're using. And one of my biggest recommendations is that if you're still using what I call an old-fashioned paper or cardboard emery board, I'm sorry to say this, ditch your grandma's emery board. You're a little bit in the dark ages. It's time to move on to a precision glass file. We sell one. It's called the Dr. Dana Precision Glass File. It's the most simple tool, yet it is a game changer if you have peeling, breakage, splits, ridging. It's going to create an actual perfect smooth edge. So I did this experiment, which was really exciting. And we have images of this where I filed the edge of a nail with a typical emery board, half of it with an emery board, half of it with the glass file. And the emery board, it turns out, creates a edge to the nail that looks like the Rocky Mountains. You think you created a smooth edge, but microscopically, there's crevices that are going to turn into splits and breakage. And that's why polish will peel prematurely and chip, and you're going to get nail splits and peeling and breakage. The glass file creates an actual perfect smooth edge, which is going to be less prone to all of that breakage and splitting and peeling and premature polish chipping, which is the worst. the other nice thing about the glass file is, from an environmental perspective, sustainably speaking, it never dulls. So you will have it for life, unlike, a disposable emery board, which is another thing that we're throwing out. I'm very big into being able to reuse as opposed to throwing away. And you can sanitize it. And it comes in a carrying case. It's a great gift. It's a game changer for brittle nails. And it's, I think, $15. So it's kind of a no-brainer.
I love it. I'm also a big fan of bringing tools with you when you go get a manicure even, right? So that you can, because
yes, just don't forget.
I'm so picky. Yeah.
Just don't forget to clean your own tools. Because just because they're your own doesn't mean you can't get an infection from them. But yeah, so the glass file, that's my
awesome. I love it. And the whole Dr. Dana line, we'll give everybody the link and everything. Let's do our rapid fire off topic questions. You ready?
Sure.
Okay. What's the best thing you've done for your health this week? What's the naughtiest thing you've done related to your health this week?
Okay. Best would definitely be, I surfed on Sunday. I'm a surfer, and there's really nothing better for the body and the mind. And I don't know how you feel about cold plunges, but I surf
love a cold plunge
here in New York in the Atlantic. So
that's amazing.
Worst, oh gosh, definitely something I ate because I have a sweet tooth. It was either the New York Super Fudge chunk, or I really love dark chocolate covered pretzels. So those have all happened this week too.
Love it. It's balance, If you weren't a dermatologist and the foremost expert on nail health, what would you do?
That's a toughie. I love food and I love to cook. So I think it would probably be something culinary related. I nice. Love to cook for people. And I think I want that 20-minute chicken recipe, by the way.
Oh, yes. I will send it to you. Your favorite book on any topic other than your area of expertise, or you could give us a fiction book.
Oh my gosh. Wow. Well, I actually read a lot of nonfiction. I'm thinking about like what I've read recently, but my favorite, I'm reading Bill Gates' autobiography, which is called Source Code. It's incredible. Yeah. I'm just blown away by it. But fictional authors, I love Jhumpa Lahiri. She wrote The Namesake and Lowlands, and she's just the most beautiful. She has incredible way with words. I love Ann Tyler too. She's quirky and fun. Anything by her.
Yeah. Excellent. If you could cure one ailment, disease, or sickness, what would it be?
Well, I'm going to cheat and say cancer, because we know that that's not one. It's kind of a broad one, but who would not want to cure cancer?
Yes. If you were a superhero, what would be your superpower?
That's so easy. Who doesn't want to fly?
Right. What's your biggest pet peeve?
Obvious.
I know.
My biggest pet peeve? Honestly, as a nail specialist, I am going to say this. I cannot handle when people who work in healthcare or the food industry have very long nails, because I know what's under those nails. And oh my gosh.
I appreciate that so much.
That is major pet peeve for me.
All right. Last one. In your opinion, what's the next frontier in wellness?
Definitely AI. I think basically predictive health management, meaning we're going to be moving beyond just reactive medicine and using, algorithms and data to help us make decisions and cure diseases. I mean, AI is already being used in medicine. It's incredible. And I'm really excited about that frontier.
Yeah. Well, Dr. Dana, thank you again. Tell everybody how to connect with you, where to learn more, find all of your Dr. Dana nail care as well.
Sure. So best way to connect is our website, drdananails.com. And you will find all of our products there. And again, you are getting a discount code. So happy shopping. And I can't wait to see your beautiful, healthy nails.
Amazing. Yes, we'll put links to everything in the episode notes. Thank you again. Just truly appreciate your time, your expertise, and everything you shared with us. So thank you.
This was fun. Thanks so much for having me.
Absolutely. So friends, on Friday in this week's Nutrition Nugget bonus episode, we're talking about Realsy peanut butter dates. They are packaged peanut butter filled dates. The question is, though, are they really as clean as they seem? Are they like a magical snack? Maybe the best part about them was that we found them at LaGuardia Airport. So could be awesome for travel, but we'll look at them to decide together. So we'll do that on Friday in this week's Nutrition Nugget. Be sure wherever you're listening, click the plus sign or the follow button, and then your app will alert you when it goes live on Friday. As always, everybody, I'm your host, Jenn Trepeck. Connect with me on Instagram or all social media. I'm at Jenn Trepeck, JENNTREPECK. Website is asaladwithasideofries.com. Pick your platform, send a message. I love hearing from you. Really, your takeaways, your ideas, your questions. It's the best part of my day for you to write in. So please do. And Dr. Dana, thank you again for joining us. Friends, if you are not already, join our membership by going to glow.fm/saladwithasideofries to show your support for this podcast, this community, and your health. You'll get this week's recipe for the 20-minute shredded chicken verde and 20% off from Dr. Dana's nail care products. Dr. Dana, our featured guest this week. So until next week, remember, the nails are the crystal ball to your internal health. So let's all remove our polish for a minute or two or more. Take a look and choose quality nail care. Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.